Sacroiliitis is a very common cause of lower back pain. It's a specific cause of lower back pain with a specific pathologic process going on. It's under-recognized and is a clinical diagnosis, meaning we make the diagnosis by talking to you and by doing a physical exam, much more than making the diagnosis based off of imaging. So let's talk a little bit about the symptoms and complaints and history that the patients have with sacroiliac joint pain. Patients that have a sacroiliac joint pain often will have some of these prior history features, a prior trauma. And I can tell you, I can think of several examples of patients that were in a car accident and were treated for lower back pain by looking at the lumbar spine, when all along it was a sacroiliac joint injury. A prior lumbar fusion. In our rounds this morning, we talked about how 25% or so of our own patients, it's 23.3% of our own patients have sacroiliac joint pain after a lumbar fusion. That's our own data off of over 400 lumbar fusions. So patients that have a prior history of a lumbar fusion, patients that have had pregnancy, especially multiple pregnancies, are at higher risk of sacroiliac joint pain. So what do patients complain of? What symptoms are consistent with sacroiliitis? The pain is in the lower back. There's a sensation of numbness, tingling, and weakness. These are not specific, but generally speaking, patients with sacroiliac joint dysfunction have features of this. The pain can go into the pelvis, it can go into the groin and radiate down the leg. Patients will feel like their leg's giving out on them when they get up. They have a hard time getting up from a chair, and when they're walking upstairs or walking, they sometimes will feel like their leg's going to give way. They have disturbed sleep patterns. Specifically when they roll over in bed at night, it'll wake them up. They have a difficult time sitting for long periods, and when you see patients in the clinic that have sacroiliac joint pain, they'll sit with their legs stretched out and offload that joint because it's hard for patients to sit with sacroiliac dysfunction. We already talked about going from sitting to standing. The other thing that's very unique about sacroiliac joint pain is it's a specific spot. It's right over the joint in the low back, and the patients will point, this is where it hurts. So that is important information for us to gather from you and for you to tell us to make the diagnosis of sacroiliac joint function as a potential source of your ongoing lower back pain.